Okay, we continue with lump diagnosis. Sa method of diagnosis, we observe, listen, smell, and touch. First, we take the history. Sabi ng author, I will start with history taking. As we listen to our patients' problems, it is also important to listen to the unspoken information. Listen to the tone of their voice, see the way they speak, observe their body language, and note the emotions behind the voice. In this interaction between the therapist and the patient, things are not always as they seem. In some difficult cases, it can take me about 5 sessions into the treatment to actually see the real problem of the patient. And by then, they have diagnosed me to be an incompetent doctor. Many a time, male patients come with excuse of backache as their problem, when their main problem is impotence. Patients come for treatment of hay fever and forgot to mention that they have ulcerative colitis and are on medication for this. Patients feel safe to give a physical complaint even though it appears always in the presence of an emotional state. Sa clinical example, we have chronic fatigue syndrome of a female 42 years old. A woman came, sabi ng author, to me recently with her diagnosis of chronic fatigue syndrome. She was an alternative medical practitioner and dislikes going to doctors. She said that she was always tired. Her tiredness was particularly worse before her periods, and she suffered from dysmenorrhea at the onset of the period. She had a clerical job for 2 days in a week, and on the other 3 days, she saw patients at her house. She was married with no children. Besides work, she went to the gym 2 to 3 times a week and worked out for 45 minutes or so. She felt better after the gym. She was apprehensive before seeing patients because this consumed all her energy. But she enjoyed her therapy work. She liked her other job because she could meet people. Sabi ng author, I was surprised at the amount of activity she packed in a day, considering she had no energy to do them. She had a distinct edgy, high-toned voice, which was not loud, but sounded as if someone placed their hand over her mouth as she was shouting. She was mostly rather pale, but would have a red face, especially after a gym workout. She always complained about the patient missing their appointment with her, friends not coming to assign dates, and how at work her team got praised when she had done all the work. She needed to vent these feelings, which seemed to have stayed with her a long time and sapped her energy. Sabi ng author, I asked her why she felt so strongly about everything and why she could not act on her feelings with people concerned. She came to the picture of liver yin and qi deficiency with a quick rising of yang, which made her quickly angry and lowered her tolerance. Though she could not directly confront those who angered her, she showed the anger on nonverbal ways. The physical exercise was a God-sent gift for her, as it allowed her to vent all this pent-up anger. She found it difficult to let out or eliminate emotions, and she had problems starting bleeding, hence the dysmenorrhea. I then treated her with points, liver 8, tonification point, UB18, back shoe of liver, LI4, the great eliminator, lung 1 and lung 9 to strengthen the lung yin, which in turn controls liver, gallbladder yang. Spleen 6 and spleen 8, symptomatic points for dysmenorrhea. Do 20 to help her detach from the situations that made her angry. And then 6 for energy. It took me 5 sessions to come to this conclusion because she always thought her problem was physical. What I had got in the first place was her diagnosis of herself, not her symptoms. This is a common problem with patients coming with a pre-made diagnosis. Either theirs or others. So as you can see here, history taking is mainly to go through the motions of not missing something important. Our diagnosis session goes on beyond the first consultation. We have to keep our eyes and ears open all the time.